By the time I was 29, I got to a point where I had just terrible sciatica pain. I had numbness in both feet, and the doctor finally decided to do an MRI when they discovered a pretty significant size herniation in my L4, L5 region. And the relief was almost immediate. Things were different 20 years ago. It was a little bit more extensive surgery back then.
A microdiscectomy is used to treat a disc herniation, and we're only going to remove a small fragment of that disc, maybe 5% of that disc material. And it's a relatively quick procedure. In the world of spine surgery, it's sort of the equivalent to an arthroscopic procedure, although it's not technically arthroscopic. And so this is a model of the spine, and your back skin would be here. And we're gonna make a small 2-centimeter incision for a 1-level procedure. Slide the muscle tissue over to the side and get access to the space where the disc herniation is. And on this model, let's say it's here. This is a far lateral disc herniation. This is a unique type of disc herniation. Usually they're more rotated into the spinal canal region. And so once we get to this space, we're gonna have to shave a little bit of bone. And we take a ligament that's overlying that area that you don't see here. And once we have that opened up, then it's safer to get access to that disc herniation that's being compressed by the nerve. Sort of thinking about it, if you got a big disc herniation here, a big ball of tissue, and you got a tiny little hole, and you're trying to work through that tiny little hole to pull all that material away, sometimes that's hard to do, and specifically when there's a pliable nerve there, a sensitive nerve, that could be traumatic to the nerve. In essence, we're making the hole bigger to make the surgery easier, but also safer for the nerve that's getting compressed. Once we take that disc material away, we then just let the muscle fall back, close up the wound, and it's all done. It takes maybe about an hour. Oftentimes we can do it as an outpatient procedure these days. Come in the morning and you can leave by the afternoon.
The day of my surgery, I was pretty nervous because everybody have heard some type of story about, you don't want to get back surgery. It's like the worst surgery in the world. I went in early that morning, and I could say by that afternoon, I walked out of the hospital.
For this type of procedure, the anesthetic time is relatively short, so you don't often get a catheter into your bladder. But for longer procedures, maybe a 2 or 3 level discectomy, you will get a catheter. Immediately after the surgery, often patients don't complain of too much back pain, but clearly sometimes we're working around the back and it can be painful. Generally, we want patients to stand up immediately after the surgery and they're up and they're walking. And if they had that red hot searing sciatica type pain after the microdiscectomy, patients are able to sort of cut through the chaff of the back pain and notice that their searing sciatica pain is gone. You're gonna be able to go home after you meet a couple of measures. You gotta be able to walk, your pain's gotta be under control, you gotta be able to urinate on your own, and you gotta be able to keep food down, not being nauseated and vomiting. If you meet those 4 endpoints by my standards, you can go home. And then as you're at home, all I want you to do for the first couple of days is to walk. We want you to avoid the BLTs, bending, lifting, twisting. Because the more bending, lifting, twisting that you do around your back, the more you're going to stir up the pot and irritate some already irritated muscles.
I had my surgery, my wife was there, and I didn't feel any pain. And they let me see the little incision I had, which was about maybe a 1/2 inch incision. And I had a cup of water and I was ready to go.